What's up, y'all? We're getting ready to go live with Dr. Wilson. We're going to talk about HIV, and then that's going to be the first show. Then we'll get into childhood obesity. So, I tape them for library and for reference points. So, here we go.
Your camera looks better than mine.
They did a good job on this.
This
new camera, and I did
look at that.
I did an upgrade, and it changed everything.
Really?
And I normally don't do the upgrade.
I'm a little jealous.
It kills your battery.
Yeah, because it kills everything, right? And things don't.
You have iPhone too?
You tend to lose, yeah.
iPhone user.
I know. All right,
All right, ready plus rock. All right, you are tuned into Your Inspiration Health. I am Nikki Bean here with my partner, co-host
Kurt Billups. What's up, everybody? I was waiting to see if she remembered my name. That's what that was about. But yeah, she still remembered me. So yeah, no, this is Kurt Billups. But I'm excited today, Nikki. We got a special guest
super special
in the house today. Okay?
Yes.
And why don't you go ahead and do
Dr.
the honors?
Stephen Wilson from
man.
Forest Park Medicine.
Yeah.
Pediatrics as well,
Pediatrics,
correct?
absolutely.
Yeah, so tell us a little bit about you and let's just go for it.
Yeah.
Okay, great. Well, thank you for having me.
Yeah.
So my name is Steve Wilson. I'm a primary care doctor in the Forest Park area. I've been there since 2010. I'm trained in both internal medicine and pediatrics, and did some additional training in HIV prevention, as well as some work in research. I graduated with a master's in Harvard in research, and have done some work around secondhand smoke exposure in children, and some of the racial differences we see in that and how it's metabolized. So.
Wow.
Okay.
And for those of you who don't know, Dr. Wilson is yet another African-American professional or man of color who's a professional that actually stays engaged with the community, that stays engaged. We can actually find him. Believe it or not, I'm touching him right now. I have my hand on his forearm. So this is another leader in our community that doesn't mind going belly to belly with the community and really being accessible. So I want to say thank you, because I always thank
you for having me.
I'm always thanking practitioners like you, because it's very rare that they show up. Okay, and so thank you for showing up.
So if you're a practitioner listening, make sure
Hey,
you
message. Okay.
So yeah, Dr. Wilson, you were giving us some great information before we got started in regards to HIV prevention.
Yeah, you threw a word at me, right? And it was I'm gonna mess this up, people. Pre-exposure finish it.
Pre-exposure prophylaxis.
Go for it.
Also known as PrEP.
PrEP.
So this is an innovation in HIV prevention therapy that unfortunately is not well known in our communities, and it really should be, because it has really changed the game at preventing HIV infection. Now, PrEP is a concept, but right now it's just one medication. It's a medication that's combined with two drugs called emtricitabine and tenofovir disoproxil. But most people who probably know of it have known as Truvada. Truvada is an outstanding drug that actually helps to prevent HIV acquisition in about 90% of people. It specifically works in men who have sex with men, but also in IV drug users, and also men and women who have sex with each other. So it's an incredible technology that has really changed the game again in preventing HIV acquisition. But unfortunately, it's not well known in our community.
Right.
And that's one of the reasons I wanted to come and talk about it, because again, when you look at HIV numbers, particularly in the African American community, we unfortunately still are about 50% of the new HIV cases based on some 2015 data.
I never knew.
And we only represent about 12% of the population. So we are significantly overrepresented by about 4 times. And if there's any community that really needs to have HIV prevention technology truly in the community, it's our African American community.
Wow.
So I'm here to talk a little bit about why it's important, how effective it is, what are some of the side effects, but what we can do to try and improve the use and increase the use of this technology within our community.
Wow. And you're saying that this is a prevention drug.
This is a prevention drug. So to get this drug, you have to be HIV negative.
Okay.
And you have to be tested every 3 months. So the way that we prescribe it is we only give you 90 days worth of it, because you have to come in and be tested for HIV, but other sexually transmitted diseases.
Got it.
One of the benefits of this is they found in San Francisco, when prescribing this, having patients come in every 3 months, they were able to identify a lot more cases of syphilis, chlamydia, et cetera, and treat those. And actually, they found that the syphilis rates went down in San Francisco.
Is that right?
Wow.
So it had an extra benefit by having people come in. But you have to be HIV negative. This medicine can cause some reversible kidney issues. So we have to monitor your kidneys. Also can cause some reversible issues with your bones.
Okay.
Again, these are all very minor and
Yeah.
reversible when you stop the medicine. This is not a medicine that you need to be on lifelong.
That's what I was going to ask you. How long does?
How long?
But basically, as long as you're engaging in the behaviors that are going to put you at high risk for
Got it.
HIV.
Okay.
One of the good things, and I was just reading a study about this last night, is that the percentage of people who take this medicine is about 60, well, actually probably about 80%, whereas those individuals with condom use is only about 20%. So
Say that part again. That's good.
people who are on this medicine
Yeah.
are more likely to take it, like 80%, but they're only about 20% likely to use condoms. So
Is that right?
now we certainly recommend that you use condoms while you're on this medicine
course.
as well to prevent HIV acquisition because it's not 100%.
Right.
But the nice thing about this, and it's kind of like the oral contraceptives with women, women would much prefer to take a pill and not have to think about it
Yeah.
and have to take something at the time
Right.
when you're
Right,
having
right at the-
intercourse.
yeah.
So,
Wow.
I think it's again it's a great technology that has tremendous benefits to our community at preventing HIV. And again, it's
Yeah.
not something that needs to be taken lifelong.
Yeah.
But certainly during that time fair where we see people are going to be at risk, it would be great to continue it. And with the rise in IV drug use, and it's also effective in IV drug users, not as effective as it is for men who have sex with men, but it is effective. We are starting to see a rise in HIV and hepatitis C cases. So it's another reason to have this medicine out there to prevent HIV acquisition from those who are engaging in IV drug abuse.
Let me ask you a question.
Absolutely.
As you've been studying and doing this drug and in your practice recently, have you found that there are more neighborhoods in the city of Cincinnati that have stronger positive results in HIV versus others?
Certainly. Now, I think that's evolving a little bit.
Okay.
Certainly, I think our urban areas were probably the most likely to have higher rates of HIV. But then I think with the increased heroin use, I think you're starting to see that spread, and you may start to see that spread into some of the rural communities. I know in southern Indiana they had a problem with this about 4 years ago, where normally they would have maybe 1 or 2 cases a year, and then they had 15 in the course of 3 months.
Oh boy.
Wow.
So the CDC came down and investigated, and they found that basically there was a group of individuals who were using injection drugs, and someone who was positive got into their network, and before you know it, it spread to another number of other people.
Wow.
So that's another thing that we really have to kind of keep an eye on, because we're already seeing an increase in hepatitis C, and oftentimes when hepatitis C increase, HIV follows.
Yeah. So with this 50% number with new HIV cases,
New HIV cases.
are we talking about both men and women in the African American community? Or
Both men and women, but probably
Yeah, who's dominating in that statistic?
it's still men that are dominating.
It is
and That's
men?
the point. It's still dominating.
So these are same-sex relationships.
Same-sex relationships, absolutely.
Predominantly not mostly intravenous. It's mostly same-sex
That
relationships.
is correct. That is correct.
So guys, the messaging here is pretty clear, right? There are ways, if you're going to engage in high-risk behavior,
Exactly.
there are ways there are mechanisms you can set up to help prevent.
Absolutely.
Disease, right?
And I think that's the message that we want to share is that, unfortunately, condoms have been around for years,
Yeah.
and unfortunately, people aren't using them appropriately. Otherwise, we wouldn't see the high rates of HIV that
Right.
we have.
Right.
So we need other mechanisms to help people protect themselves from acquiring HIV.
I have to imagine. I was speaking to a social worker a couple of weeks ago, right? And she deals with people who already have the AIDS diagnosis, and she was saying, Kurt, one of the things, and I never knew this was a thing. She said one of the things that makes this work so challenging in that space is that even after someone like you has confirmed diagnosis, they still are in denial. And won't take the medicines because they don't want to accept the diagnosis.
Yes.
Is that right?
That is true. That is true. And it's a tough diagnosis to accept.
Yeah.
Now, I think the one thing that we know now is HIV is not a death sentence.
Okay.
And if you look at some of the data,
So glad you said that.
Yeah, the death rates have gone down even in the African American community. Now we still see a pretty significant disparity. About 2 to 3 times African Americans who have HIV who are dying at rates that are higher than our white and Latino counterparts. But the death rates have gone down. I think the other thing that we know is medicines have become more available.
Okay.
And HIV is being treated more like a chronic disease than a death sentence.
And that's good news, right?
That is incredible news. I was at a presentation about a year ago.
Yeah.
And they showed a picture of how HIV was treated 10 years ago with a handful of about 15 pills.
Okay.
And now HIV is treated with 1 pill a day or 2 pills a day.
Wow.
So we've made tremendous progress.
So the advancements are there.
Advancements are there.
Yeah.
But again, our goal is to reduce the number of acquisitions or infections. And again, while it's great that we can treat people as a chronic disease, our ultimate goal is to, let's see if we can prevent people
You
from
want to
acquiring
catch them, right?
Exactly.
Right.
Okay, so how important is it that, we begin as a community to, get beyond social stigma around stuff, have conversations, say to you, hey, doc, I'm engaged in same-sex relationships. Do you see us getting any closer to dropping that guard instead of being so cagey like we are today?
I do. And I think one of the things that you're seeing as well is there are boards on different buses, advertisements that talk about PrEP.
Okay.
Now, I happened to see a friend of mine on Facebook post some information about PrEP. And, of course, many of our friends were very, very negative about it because it showed two African-American men who were, they weren't intimate, but they were hugging.
Right.
And it says, protect yourself with PrEP. And I think they took that as an affront of black masculinity. And I had to weigh in on it and say, hey, when you know the HIV death numbers or the mortality rates and the acquisition rates, we should be applauding that someone's advertising this information and making this available.
Because it's a lot closer to the truth than we want to deal with, right?
Now, one of the things that we try and do, and particularly in our office, is we put up information to let patients know that it's a safe space to come talk about it.
Okay.
We'll have some pamphlets.
Yep.
We have some information in our bathrooms, and we've actually posted our office on the Ohio PrEP website. So if individuals are looking for someone who can prescribe PrEP for them, they can contact us.
Wow.
I think currently we have about 5 patients who are on it, and who are all doing well. And we're hoping that more people would take advantage of it.
Yeah.
Exactly. So as a patient, what would I do? So do I call my primary care doctor as a female, or would I call my OB? What's the process?
Probably calling your primary care doctor.
Okay.
I'd probably call your primary care doctor. You could also go, and I believe it's the website is Ohio PrEP Providers. You can put that in Google and it'll pull it up. But contacting them or looking for some other providers that are in the area. And most primary care doctors, if they don't know how to prescribe it or are not prescribers, they can put you in contact with someone who can.
Okay.
Yeah. So not all doctors are able to prescribe this drug just yet.
They all are. It's just whether or not they're willing.
Whether they're
Right. Okay.
Not everybody's there yet.
It's really not that difficult to prescribe.
And you said insurance coverage.
Insurance coverage is actually really good.
Okay.
What we've been able to find is, certainly all of your Medicaid or government type insurances will cover it. Most private insurances will cover it, but in case they don't, Gilead, who's the maker of PrEP or Truvada, often offers some discounts. So there are ways that we can get it covered.
Okay.
So don't worry, don't fret when it comes to the financial part. Get to your doctor.
Get to your doctor and ask about it, and we can find out ways to get it covered.
Ways.
I mean, it is a little expensive, but Gilead has really stepped up and started offering a lot of discounts.
But it's worth it.
It is definitely worth it.
It is worth it.
Because again, while we have made tremendous progress in HIV treatment, our goal is HIV prevention.
Gotcha.
It's HIV, and this is one tool that's available. Now, I will say there's some things that are coming down the pipe that may even be more innovative than this pill. There's actually an injection that's being studied now called cabotegravir. And they're actually doing some of the work here at UC, where you can get an injection every 2 months, and then you're protected.
And you're good, instead of having the pill daily.
Exactly.
Wow.
There's a vaginal ring that some women can insert that would actually help protect it. So there are things that are coming down the pike, and there may be an antibody that they can inject that will actually work for probably about 6 months. That would help.
So the medical advancements around this
Medical
subject
advancements
are
are there.
they're there. People are.
They're there.
I mean,
We just need to make sure that we get from the bench to the patient.
Yeah.
We need to make sure that patients have access to this technology.
so guys, you heard Dr. Wilson. He's doing his part on the medical side, right? He's making sure that people are being educated, that you know that this is available, that you understand prevention is the way to go. We have got to do our part as a community and start to drop our guard, have these conversations, right? And I'm going to tell you something. If you don't have a PCP or you'd like to learn more information, Dr. Wilson, tell them where you're located, give them the address to your practice and the phone number to your office.
Absolutely. So we're Forest Park Internal Medicine Pediatrics on the corner of Winton Road and Kemper. It's 11550 Winton Road, Forest Park, 45240. And our phone number is 513-924-8200.
And are you guys taking new patients at this
Always
time?
taking new patients.
Yes, awesome.
Yeah.
Always taking
And guys, I know we're here to talk about HIV, and I won't get into that, but I'm telling you, if you contact Dr. Wilson's office, especially for those of us or people of color, I will tell you that there is a focus on what's plaguing our community in that office, and that's very important. Identification is very important. It helps to bring more continuity in care. Yeah. Having somebody who relates, understands the community is a benefit, and in the healthcare world is starting to realize that that identification matters. Absolutely. Is that right?
Absolutely.
Yeah.
Absolutely. And I think, again, the thing I want people to understand is be comfortable coming and asking about it. There's a no judgment zone.
That's the point.
Yep.
Our goal is to make sure everybody stays healthy.
That's the point. That's the point, guys. This is about health, and so and listen. I'll strongly encourage people, if you know of someone in your family who may have an addiction problem, and you suspect that there may be some intravenous usage, call Dr. Wilson's office. I would submit to especially a lot of our younger generation and some of the parents and some of the people watching, and for the older people, if you are engaged in high risk sexual behavior. Guys, reach out to somebody, protect yourself, and for God's sakes, protect my children, protect the other families out there, right? Yes. So this is important when we have these conversations. Absolutely. Because it's not just about your protection. This is a protection that has a blanket approach. This protects community. And so we want, I get it. I love the message. And this is literally about, hey, you don't have to end up with the diagnosis.
Exactly.
You can prevent that diagnosis.
We can prevent the diagnosis.
Yep.
So we're going to strongly impress that upon you. Dr. Wilson, rattle off your address one more time, phone number, because sometimes they don't get it.
Yeah.
Absolutely. So it's 11550 Winton Road, Forest Park, Ohio, 45240. Phone number is 513-924-8200.
Yeah, man.
Awesome.
And I hear there's a health fair coming up, right, Dr. Robinson? And you're going to be doing some talking there. What's on the on the agenda?
I'm going to give some more details about PrEP and some of the data from some of the studies that have shown and why it's important.
Guys, so listen, if you plan on coming out, which I strongly encourage everybody to come out, Dr. Wilson will be on site. Yep. He'll have some information. He'll be giving a lecture. And part of my job is to make sure people are in the room and getting the information. So please come out. You'll have an opportunity to meet and maybe even get a couple of questions in at the Q&A of his lecture. So I'd strongly encourage that. Now, this is great. Anything else on this particular subject matter that you want to mention, or if there's any events that you have coming up, I'd love to hear about it.
Yeah, just want everybody to get tested so you know your status.
Please, yeah.
And when you know your status, let's do the right thing. If you're going to be engaging in high-risk behaviors, let's make sure you protect yourself and protect the ones you love.
Yeah.
Love it.
Yeah,
all right.
Awesome. So we'll see you Saturday at the
see
Day
you
of
Saturday.
Wellness.
Saturday.
Hill.
I will be there.
Yeah, 1701 Mercy Health Place.
Yeah.
And you go on at 1 o'clock, I believe.
1:30.
He'll be there. He told me, he says, Kurt, I'll be there by 1. And so, hey, you may catch him in the hallway before the lecture and get
Just
a chance
show up. Be there.
Show up.
Yeah, get some great
Well, Dr. Wilson, I tell you, we are always honored and very grateful to have you come in and to really give it to us straight. And again, like I said in the beginning, thank you for being accessible.
No, thank you for having me.
Yeah.
Again, I thank you for this venue to allow me to kind of share some of the information about,
No doubt.
again, this new technology that, again, is innovative, unfortunately underutilized, but certainly that's something we're trying to change because we want to make sure the numbers of HIV cases in our
No doubt.
community
And
goes to zero.
yeah, and anytime that there's a message that you think community needs, let us know. We'll get you on the air. I'd love. And listen, there's a select few. If they call, we're going to open the doors because we know what you're bringing saves lives. That you're genuinely concerned about saving lives in the community. So, Nikki, that's all I got. So this was amazing.
All right. Yeah. Thanks, Dr. Wilson.
Thank you.
Thank you, buddy. All right, good.
What's
Show
the next
one.
Yep.
All right.
All right. You
That
are
was
tuned
great.
into
What'd you
your
think?
inspiration.
I thought it was
Was that good? Was that good? We didn't miss anything, right?
Nope, we
Okay.
good. All
All right,
right.
do it.
You are tuned into Your Inspiration Health. I am Nikki Bean here with my co-host, Kurt Phillips.
What's up? What's up, everybody?
And we are so delighted to have Dr. Stephen Wilson back in the
Back
house.
again!
Back. We could not get away from him.
That's
we
right.
needed him back immediately. So he is back, and today we are talking about childhood obesity.
Oh, wow.
And this right now is really dear to my heart because my son has obesity, and he is only 9. So, Dr. Wilson, tell us, give us some information.
I mean, this is a struggle. This is a struggle for our community, for our society. When you look at some of the numbers from the CDC, about 20% of individuals, children, those are under 18, have obesity, which we're defining as having a BMI percentile of greater than 95%.
Right.
Unfortunately for the African American community and the Latino community, it's upwards of 22 to 25%.
Oh, wow.
And particularly we notice this in our young girls, when they start hitting adolescence, the percentage of individuals who have obesity has really gone up. So this is a struggle that we have.
Yeah.
And there's a number of reasons.
Yeah.
I mean, I know everybody likes to put it on genetics, but the environment is key.
Thank you for saying that.
environment
Oh,
is key.
I'm so glad
The
you
environment
said that.
And there's some things that we can change and some things that unfortunately we can't change, but we can modify our behaviors in order to fit our environment.
That's
So
what I was
you
going to
just
get
said a couple
into.
of key things. One, you said some things we can change and can't change. So let's start with what can't we change?
Okay. So one of the things that's often a struggle, and this has been discussed in Cincinnati and other places, is the concept of a food desert, where there are areas in this city where there are no grocery store or there's no access to any fresh fruits or vegetables. And unfortunately, we don't have the ability to change that right away. Now, I think there are some organizations that are really working hard on trying to do that, and there's one in particular called Brick Gardens.
Yeah.
Oh, okay.
And Brick Gardens it was founded by Dominique Peoples. What they've tried to do is identify vacant lots or vacant buildings and transform them into urban farms. So using hydroponics technology, as well as using grow towers, they're actually able to grow different fruits and vegetables indoors throughout the winter season, the winter months.
Wow.
So, and then they're able to distribute those into the local community. So not only do you reduce some of the pollution to the environment because it's not being transported from
Right.
across the state, it's
Yeah.
actually being grown in your area, in your community, and being distributed to that community through various grocery stores or farmers markets. So that's one thing that is, fortunately, we can't change a lot about where grocery stores are, but we can, and there's some people that are working on changing on that access to fresh fruits and vegetables by growing them in the community. And again, I think they're a fabulous program that certainly is a model on how we can provide fresh fruits and vegetables to these food deserts. I think one of the things that's also difficult to change, but we have to be creative about it, is play spaces. Spaces for our kids to go and play, safe, that are parks, community centers, and those kind of things. And I think that's one thing that our kids often struggle with is finding a safe place to go out and to play.
Right.
And I think partnering with community centers, partnering with the Y, and actually trying to develop some of these safe play spaces is going to be critical to getting our kids out and doing things, because anyone who has a young teenage boy or school-age boy probably is fed up with the game Fortnite.
No, buddy.
Hello.
Better with most other games.
We have to find opportunities for our young boys and girls
Yeah.
to put the games down and to go out and interact with each other and get involved in some type of physical activity.
I agree.
I promote a lot of sports in our office, encouraging kids to play soccer, basketball, gymnastics, anything that's going to get them out playing, whether it be jump rope or any of those kind of things. Because the more they sit playing Fortnite, the more they're going to continue to gain weight and move into that obesity realm, because they're not burning any calories except from moving their thumbs.
Right.
Yeah.
Yep.
And how important, in your mind, how important is it that we encourage or impress upon our young people, our children, increase physical activity?
Oh, it's paramount.
It is, right?
It's paramount.
Can you speak to that a little bit?
We've got to impress that upon them, because, again, one of the problems that we see with obesity is it leads to a lot of other health problems.
That's right.
Yep.
Cardiovascular problems. So they start getting hypertension at a young age. They start having problems with hyperglycemia, which goes on to diabetes. They start having problems with sleep apnea as they gain weight, maybe even developing asthma. And then I think one of the things that's under recognized is they start developing some mental health problems around anxiety.
No
and
doubt
depression.
about it. No doubt about it.
So physical activity, I mean, even in the absence of weight loss, physical activity is going to have tremendous health benefits.
Thank you.
Lower blood pressure, lower glucose.
Thank you for saying that.
Increased wellness, sleeping, it'll improve your sleep.
Yes.
So we've got to do a lot of work around getting our kids more active. Now, there's also a nutrition piece to that, and one of the things the CDC has come up with is this 5-2-1-0.
Okay.
Whereas 5, that our kids should have at least 5 servings of fruits and vegetables a day.
Okay.
They should have 2 hours or less of screen time, and screen time would be the phone as well.
Yeah.
They should have at least 1 hour of physical activity a day.
Okay.
And this is the one where I think a lot of kids get a lot of calories that they don't need. We really should have 0 ounces of calorically dense drinks. So no pop, no Gatorade.
Capri Sun.
Capri Suns. It should be water. Skim milk, fat-free milk.
And when you're giving the
milk.
kids fruit, I'm assuming you're not talking about fruit snacks that are wax-based candy.
Exactly.
Okay, let's clear that up.
A whole apple, a banana, some grapes.
All right. Yeah. Guys, I tell you, I know we picked this stuff up, but it's not your fault. Listen, you've got the food industry and the grocery industry. They put labels on this stuff. They'll have you thinking that all yogurts are healthy. Not true. They'll have you thinking that you're buying a fruit snack. And it actually has real fruit in it. Not true.
Correct.
Fruit Loops don't have fruit, guys. They just don't.
Correct.
And we need to, and that's stuff that we need to get educated. Which brings me to my next point. How important is it for the guardians of these young people to espouse this same beliefs and to get themselves involved in these processes for their children?
Oh, it's critical, because you buy the groceries.
There you go. Talk to that a little bit.
I mean, you buy the groceries, you control what's coming in and out of your house and what they have access to.
There you
go. You control the funds. So, I mean, it's critical. It's totally critical that
they're going to buy what mommy or daddy or guardian is. They're going to eat. They're going to eat what the guardian's buying. Is that what you're saying?
They're going to eat what they buy, and they're going to eat what's in the house.
That's true.
And they're going to eat like them.
Exactly. So I think trying to find healthier options is critical. I remember, and again, this is where I've kind of gotten on this Gatorade and Powerade kick, because I remember I was at one of my son's basketball practices, and the kids ran up and down the court twice, and then all grabbed the Gatorade. And I was like, well, you haven't done anything. Why are you getting Gatorade?
All right.
You haven't sweated.
You just want salt.
You just
want the salt.
That's right. Grab a water.
That's right. Okay.
So
that's huge.
And unfortunately,
that's huge.
They've done a great job. And again, I think that's one place where we don't really see is getting our calories through a lot of these liquids, is that the beverage industry has done a great job of kind of normalizing Gatorade, Powerade as regular beverages.
As a drink, as a regular drink,
a recovery.
It's a recovery. That's right. It's to replenish you.
And
that's
I
right.
think unfortunately, we have a lot of our kids who are drinking Powerade, Gatorade, and so forth. Again, like it's a beverage, large containers, and getting a lot of salt and a lot of sugar that they probably don't need.
Yeah.
So when it comes to childhood obesity and pre-diabetics, okay, so we both are, diabetes educators, diabetes prevention educators, and things like that. And we see a lot of curriculum out there for adults.
Right.
I am curious to know, why hasn't the industry, whether it be between the healthcare marketplace and the insurance companies and all these other social groups, why is there no curriculum that we can start to roll out for young people the same as we do for adults?
That's a good question.
Yeah.
That's a
But
good
you
question.
know what?
I think there may be some pockets of different curriculum.
Yeah.
But
Right.
I think you're right.
But where's that standard like they gave us with the CDC with
Exactly.
DPP? Where's that standard piece?
Exactly.
Right?
Now, there is a program, and I think that the Hamilton County Health Department, and I think probably the Cincinnati Health Department, also have that's called, I believe it's called We Fit, or where it's really talking about getting kids out and moving around and doing more. But you're right. I don't believe, and I'll have to look into this. I don't believe that there is a standard curriculum for.
And maybe I thought about this. And I said, well, maybe it's because when they did the initial testing for the diabetes prevention program, 3,000 people, one metformin group, one placebo group, right, and so forth and so on, and then one lifestyle change group, right. Maybe it's the study hasn't, maybe they need to support it with that sort of study, and it's so much harder to do that on young people.
Now, there is a pediatric obesity.
So they could use language from that. They could use some of that.
So they could use that, yeah. But I don't think there's a pediatric diabetes guideline that I'm aware of. Now, I could be wrong.
If I'm wrong, because I want to stop saying that if it does exist, and I want to start teaching it.
Yeah,
so if it exists, then I want to get my hands on this
and
stuff.
I'll actually have to make some calls and take a look.
Yeah, because I would love, because I'm telling
but there are some obesity guidelines. I know that there are some
right.
pediatric
So we could use that as
correct
as the pilot, the foundation,
correct,
and then build from that point.
Absolutely.
Because a couple of things that jump out on me. James Baldwin said that the children have never been good at listening to their elders, but they've never failed to imitate them. And we want to be what we see as young people. And if you can say how important it is to eat clean and be active and go outside and play and put that video game down, but if mommy, daddy, guardian are eating poorly, not being active, right? And it may not be a video game, but you're binging out on Netflix.
Or Facebook.
Or Facebooking it, right? And so guess what? You're sending a mixed message. The messaging doesn't align with the messenger.
Absolutely.
Yeah.
And so we have to be very vigilant about that. And I think that I have a history of chronic and preventable disease in my family. I've lost several family members, friends, to chronic and preventable disease. I do have a daughter who has dealt with weight and obesity her whole life. And you're right, this is not always just about you're fat and you're lazy. There are environmental stressors that play in. Oh my God, there's so many.
Psychological.
Is that right? So there are so many reasons why we're obese in society and why we're making poor choices with food and activity. And so I think as a behavior conversation, we really need to look at our behavior community-wide and start with your household. What is the trend? What is the culture? Is it that of is it conducive to a healthy lifestyle or not? And it's real easy. Just open your fridge, open the cabinets.
It all starts.
You'll
in
see,
household.
right?
I mean, the
You'll
kids,
see.
like you said, they're gonna do what they see us do. I mean, if here it is, I can diet all day long. I diet frequently, so I can change my eating habits, but I can still go in the store, and I usually tend to still buy something quick for my son. So I shop around the grocery store. And that's how I do. That's how I do for me. I go around the grocery store and I get what we're getting or whatever. But usually for him, I still slide down that frozen section. Okay, you can get some frozen waffles because you got to get up and run. But why not still make him some healthy waffles, myself, freeze them, and then they're already available to him. So even though we're looking at something, I heard the conversation of, okay, well, what would be the standards just for the children? Really, it still models after the parents.
It's the same.
It's the exact same thing.
Absolutely.
It models after the parents.
Right.
The way we eat is the way our child should be eating.
No
we
doubt
should
about
not
it.
change everything. Just, okay, this works for us. but this works for him. No, it all works in the same household. You're under my household. You're under my roof. I buy the groceries.
That's right.
I pay the bill. So you have to eat. Now we can make it fun. Now me and my son, we do make like homemade Lunchables.
Absolutely.
He likes pizza. One thing that worked in my household was when we did keto. Keto was great for us because he liked the pizza thing. He got to make his own pizza.
Yeah.
We skipped out on the crust and all that stuff. So that was fun for him. We redid cheese conies and just turned into a cheese coney casserole.
Right.
It actually worked for him. So we really have to be creative as parents. But one thing that actually kind of bothers me is kind of in the fitness world. And Kurt, you kind of chimed in as a trainer. Now I know normally like at the day of wellness you jump in and you're like running around with the kids and doing that.
Yeah.
But throughout the year, we will see tons of 5Ks for adults. There are some for children because I've looked them up. But we will see boot camp for adults. We will see Zumba for adults. But what about the children? Why has no one taken the initiative to say monthly or weekly? Somewhere there is a group of children outside of football, because my child does do that, maybe on just a Saturday, so they can get up and have something they need to go to. Me personally, I would do this for my child because I am concerned about my child's health. So yes, get up on Saturday, skip the cartoons, you go to boot camp, and mommy's working out with you at the same time. So it's a kids boot camp. They see the other kids, they get excited.
You want to take it for? I'll go after Dr.
One of the things
Wilson.
that's always a challenge with that too is that with kids, you really have to make it fun.
Yes.
And when you say boot camp to kids, they don't see that as
Oh no, God! You say physical activity, a kid's going nuts.
Like, no!
What do you mean physical activity?
So you've really got to find other creative ways to get a move. Dodgeball,
Exactly.
jump rope,
Let me
dancing, dance off. So things that are going to kind of get them up and moving, but not kind of have that.
That's right.
That signal that hey,
I'm out of exercise. No
But
kid
you
wants
know
exercise.
what? After Dallas did his 3-mile on Saturday, he did a 3-mile race. Now halfway through, he was somewhere crying. Somebody else did tell me. Somebody did pick up my child
Poor
on
baby.
Glenwood Avenue
Aww.
in Avondale,
Poor
and
baby.
they brought him the rest of the way. But he was smiling so hard when he crossed that finish line. And yesterday, he said to me, "Mommy, I want to do that again."
Okay.
Well, that's
Even
good.
though he
That's
cried,
That's a good
he
thing.
was like, "I want to do it again."
great.
And he named off several people, and Kurt,
good.
you were
Yeah.
one. He was like, "Do you think they'll do it with me again?" Because he's actually he
Yeah,
wants
no.
to do better.
Right.
So some kids they'll go for it.
Some will do it.
Some will do it. I think to go back to your original question, I think part of the problem was, one of the biggest mistakes, as we started to trim budgets in the school system, was to remove PE. PE was a standard. PE, for those of you that didn't come up back in those days like we did, that's physical education. And there was a physical education platform in the school system. Now, the only way a child in most public schools gets that sort of physical engagement is if they're playing a sport.
Right.
And all children aren't into sports. And here's the other concern with the sports dynamic. Everybody's so hell-bent on winning that all the children don't get activity anyway.
Yep.
Right.
You are very right.
And so only
Although they are changing the rules.
they
on
are
that a
trying
little
to
bit.
change
They're
that, right?
changing the rules on
But
that.
again, the focus has shifted,
Correct.
and I think that's part of your problem. It was taken out of the schools.
Correct.
We depend on our school systems to start early education. Early childhood learning begins in the home and in the school. They're only learning 2 places as kids: at home and at school. That's it.
That's it.
Those are the 2 primary places they're going to learn, and everything else spawns out of one of those 2 environments. Okay, whether it's negative friends or positive friends out of school, whether it's negative family or positive family out of the household, it all spawns out of those 2 environments. And so when we remove that piece, we lost a lot of ground, and now it's gotten worse because of that removal. The other thing is this: I think that it goes back to the diabetes conversation that we were having. It is so much easier in this society to fund programming for adults versus that of children. Yeah. The money's not there.
Right.
And if mommy and daddy has the money, they're spending it on athletics, not activity.
Yeah.
Because they want a better football player. They want a star basketball player. They want a star baseball player. They're not even thinking, I just want a healthy kid.
Right.
Yeah.
Right.
Yeah.
I mean, that's true.
I mean, I'm sorry, but that's how that's
true.
what it boils.
Yeah.
And that's in all families. I'm not just talking about people of color. I'm talking about across the board.
That's everybody.
I'm talking, this is a mentality across the board.
And I think that's where some of the communities have to get together and do I live in Springdale. One of the things that they would do was just like a Junior Olympics.
Yeah.
Where the kids would come out. Now, unfortunately, it was only one day.
Yeah.
But they would come out and they would engage in different activities and they would give out medals. And most kids got some type of
they like
medal.
that.
But it taught them about competing.
Yeah.
It also taught them about moving around and doing stuff,
course.
physical activity. And it was fun.
It was
got them
fun.
off,
It
got
was
them off the phone.
engaging.
They got them off the
Fortnite,
PlayStation, off the Fortnite.
Yeah, of course.
So yeah, we definitely need to do more of that.
Right? And it's like to me today. Okay, so remember when we would go, even today, some of us, we used to go to our family reunions. I went to a family reunion on my mother's side in Georgia. I was so delighted to get there because when we did the outdoor day, it was miserably hot. So the elders had to go in. But what they had staged for us that day was activity and events that we did as a team. There was a wiffle ball tournament.
Right.
There was the old,
tug of war.
listen, there was tug of war. I've got the video to prove it.
Yeah.
There was the wheelbarrow competition.
Right.
We were doing sprints up and down and pop the balloon when you sit on them. So it was these. So if you can think, what do we do to keep the kids engaged? Think family reunion activities.
Right.
Yeah.
Think in terms of family reunion activities. And what I would love to see us do as a community when we have health fairs, I love the education platforms. I'm a huge fan. I think Dr. Robinson gets it right because he blends education with activity. Yeah. But I think for all of us in terms of that outreach and that casting that broader net around this conversation, I would love to see it in the Black family reunion. Okay? Why aren't we having family reunion activities? Wheelbarrow competitions, wiffle ball competitions. Why? There's no reason we can't do that stuff. And this encourages that behavior that we're speaking of. I want to launch, we talked about this 2 years ago, and I think we should do it. We want to do a community picnic. And we'll come in, we're going to have healthy foods. We'll pick a park, some big park in the city, and we'll do it, maybe host 2 or 3 of them that season. And we pick a park, and the whole thing is cook-offs, eating healthy, bring a healthy dish. Guess what else? And movement. And we're going to have games and activities that cause us to team up as a community, team up as families, and challenge each other physically in the spirit of fun and activity.
Yeah.
And I will tell you, there are some pockets of that going around. There's a group called Whole Again International, which does a lot of summer enrichment, where they're doing summer enrichment for kids as well as providing meals. They have what they call a fitness day called Fun to Be Fit, where they get together and they have all kinds of activities where they're running, there's dodgeball, they're jumping rope, all these little obstacle courses. So there are pockets of that, but we need to do more.
We need to do more, right?
We need to definitely do more.
Man,
Fit Fest was like that. Yeah,
Yes.
Fit Fest was phenomenal. Yes, that was the one that Tyron Stallings did. And
I
you
remember.
brought the entire family, and this event went from like 9 a.m. to 1 p.m. And I enjoyed the children being out there because they were kind of in competition with moms or dads. And then the kids teamed up. Met kids they hadn't even met. Denise Byers had them sprinting, and the kids they came out sweating. And it was just awesome. They had a push-up contest, and they got a Black Panther cup. My son was like the only kid out there, but it was like, I'm gonna do these push-ups, because they wanted to win. We need more of that.
More of
the family activity.
More of those activities.
Yeah, it's all about encouraging that active lifestyle.
Active lifestyle, and again, I think it's got to be fun. And I mean, while I applaud your son doing the 5K, I think if you told most kids his age,
they're
gonna give you side.
They're gonna say, a 5 what?
Do what?
Yeah.
But having other activities around that are gonna be fun, that's good, so that they don't even know that they're sweating and out doing activities, is oftentimes one of the more useful ways of getting them out and doing things.
And the thing I tell you what I love about your office in particular, your practice in particular, you don't assume any corner on thought. Anytime that you don't offer something, you already know the resource to direct people to. You'll say there's a great group that does it. So no, you guys, listen, that's important.
It's resourceful.
That's so important. So guys, what I'm saying to you is this is a resource. Okay, even if Dr. Wilson is not the guy that's going to take you from A to Z, he knows somebody that he probably knows someone you should be talking to if that's a true concern of yours. So again, what is the office address? What's the phone number? I encourage you to reach out to him.
Okay, it's Mercy Forest Park, Internal Medicine Pediatrics. It's 11550 Winton Road, Forest Park, Ohio, 45240. Phone number is 513-924-8200.
We'll let Dr. Listen, we want to let Dr. Wilson close us out. Anything you want to end this on? Messaging? What do you want to tell the parents? Call to action. You take this last and you close us out.
Turn off the Fortnite and kick your kids out the house and get them out doing something.
I love it. Dr. Wilson, will you come back?
I Absolutely.
Well, you will.
Absolutely.
We said that, and you came right back. Let's
have
see
him
if we
back.
can do it again.
It's a
Right?
must.
All right. No,
It's a
God.
must.
So, Nick, you want to close us out? It's amazing.
We're out. That's it.
Guys, God
That's
bless
it.
you.
Have a
Thank
good
you.
weekend.
Thank you, Dr. Wilson.
Thank you.
All right. Get my commercial. I need my
Actually,
Dr.
that was
Wilson.
3.
I need my Dr. Wilson commercial. So that'll run 3. That's perfect. So you'll do a commercial.
Okay.
And
okay.
on the radio, and you know how they do in between. This is you're listening to 103 point,
Okay.
and it'll be you.
Okay.
Okay.
Perfect.
Yeah,
Perfect.
you can tell the wife
Perfect.
and tell the family. Say, "Oh, Daddy, I heard you on the radio today.
Perfect.
Hey, honey, I heard you." All right. Whenever
Introduce
you
yourself how you want.
introduce how you want to. Just
Okay.
follow that script. So introduce yourself. This is Dr. Wilson. Blah blah blah. Whatever you want to do.
Okay. Ready for it?
Go.
Hi, this is Dr. Stephen Wilson from Mercy Forest Park. You're listening to Cincinnati's 24-hour Urban Gospel Connection. Inspiration, 1050 AM and 103.1 FM WGRI.
That's
Wow! First timer. He's built for radio. You got more
Hopefully that
talent.
was helpful.
Buddy, you got more talents than medicine, I tell you that much. Jeez, you did great. This was great. Good energy, good vibes. When does this air so we can get it out to him?
I think it's next